What is up, everybody? It's Dr. Vibe here, host and producer of the award-winning Dr. Vibe show, the home of Epic Conversations. And I'm the host of Epic Conversations.
Something's got to separate you from the rest. So you got to be willing to do whatever.
In my experience, Black men have struggles like having community with each other.
But she represents the mammy stereotype.
Now that was epic. I needed that. What is up, everybody? It's Dr. Vibe here, host and producer of the award-winning Dr. Vibe show, the home of Epic Conversations, and I'm the host of Epic Conversations 2018 Innovation Award, 2020 Best Podcast News Award winner, both given out by the Canadian Ethnic Media Association. I also co-host and co-produce the only online show in the world for dads, fathers, and male caregivers that is sponsored by Dove Men Plus Care. And being part of that team, we've reached out directly and indirectly to over 400,000 dads, fathers, and male caregivers around the world. So as always, I'd like to say you're blessed, highly favored, a magnet for miracles, and a solution for someone's problem. Hey, I got a clap from the green room. Hello, I like that from a 5-timer. You'll know about that in a moment. So as always, let's do some little hey, what's going on? If you're chiming in live, please share where you are from the comment section. Would like to shout you out. And looking forward to another epic conversation. We're broadcasting live on February 11th, 2025. Only a few more days till Valentine's Day. So are you getting anything or getting or giving anything from Valentine? Are you a giver, receiver, and or both? So it's a red conversation. No, that's just joking. So looking forward to it. And in Toronto, I've told people I'm sick of snow. I'm really sick of snow. Like, we had some snow on last Saturday evening, shovel Sunday morning, and we're supposed to be getting more snow tomorrow. Now, I measure how bad a winter is by how many times I've had to shovel snow. Well, I've already shoveled snow more this year than I probably have in the last 2 years combined. So that's too much for me. So I think a vacation's in order. What do you think? Do you feel that Dr. Vibe does enough of these to earn a vacation? I think so. And that goes in line a little bit what we're going to be chatting about this evening. We're going to be talking about health. As I always like to say, your health is your wealth. And especially these days in the Black environment, health is a much discussed conversation topic, whether it's mental health, physical health, etc., etc. For those who watch me even a little bit online, I do tell you, I go to my doctor every month. Not because I have any ailments, but I'm taking advantage of it. First of all, I've had the same doctor for over 20 years, so we get along. Bigger bonus, my doctor is the same as my father's doctor. So he has had some challenges illness-wise over the past, and my doctor always keeps a check on, are I prone to any of these hereditary wise? Like, he's had high blood pressure, prostate cancer. Every month I go see him. And the other day, someone who knows this says, Dr. Vibe, do you actually book an appointment every time you go into your doctor after you leave, after you finish? I say, I'll go one better. I make my appointment when I arrive to the office, even before I go to see him. With healthcare the way it is where I am, you never know how much longer you're going to get free healthcare. I am taking advantage of it. That's just me, but your health is your wealth. And people say, well, what do you mean by that? Well, let's put it this way. If you're not taking care of your health, it's going to impact your wealth. You're going to have to spend on it. Enough said. Your health is your wealth. With that preamble, we're going to go to a break, and you'll know why I went through that preamble with all you this evening. We'll be back in about 30 seconds, and we'll get into a health conversation for people that look like me. Hold on. What is up, everybody? It's Dr. Vibe. Good morning. It's Dr. Vibe here, host and producer of the award-winning Dr. Vibe show.
My name is Ryan Knight, one of the co-founders of the Afro-Caribbean Business Network. So he couldn't call an election now because that would be the most disastrous thing for the Liberal Party. I am predicting it's going to be this year where AI just starts to branch out on its own.
They did that on purpose.
You think so? Oh,
of course they did. Of course they did. All right. That is the Morning Vibe with myself and Ryan Knight, who is the co-executive director of the Afro-Caribbean Business Network. And you can catch us Monday and Friday mornings, 9 a.m. Eastern Time, 6 a.m. Pacific, wherever you're watching this now. And we just got good news. We got someone back. We thought she was lost, but now she is found. All right. You'll know all these little things. What is Dr. Vibe talking about? Hang in there. Hang in there. We're getting to it. Let's do some housekeeping. Subscribe to the Dr. Vibe Show on YouTube and hit the notification button. Please like the Dr. Vibe Show on Facebook, LinkedIn, and Instagram. And then if you want to advertise your business, product, or service on any of the platforms that I broadcast on, email me dr.vibe@vibeshow.com. Now, what are we talking about tonight? Let me show you, family. Let me show you the goods. So, the Black Physicians Association of Ontario, BPAO, is holding their 16th annual health symposium coming up in Toronto on Saturday, February 22nd from 8:30 to 5 p.m. in person and virtual. And that's why we're here today, to hear a little bit about it. And we have two outstanding African queens here to join me this evening. There they are, the African queens. And we've got them both. We got Chenai and Mireille with us. And let me give you a little bit of background. I can spend the whole hour just talking about their backgrounds, but Chenai is the executive director, Black Physicians Association of Ontario. And then Dr. Mireille Norris, sorry. I'm going to butcher this up. What is your position at Sunnybrook Hospital? Because I know I'm going to get it.
All right. So I'm a staff physician, internist, and geriatrician.
That's the word I didn't want to mess up.
I'm also associate professor of medicine at the Thermography Faculty of Medicine, where I'm also the Black Health Team lead. And I'm the Department of Medicine faculty lead for Black and Indigenous medical learners.
I wouldn't have got all that in one breath. So I'm glad you took care of this. Well, ladies, I want to say thank you so much for coming and sharing with us this evening. I'm looking forward to an epic conversation. I see there's a comments here. Hey, look who's here. Ryan Knight, my co-host on the Morning Vibe. Looking forward to the conversation. Good stuff. Well, that is good. We're not alone. And we also have a secret agent, another doctor in the green room. We won't tell you who that is till the end. We'll hold that off till the end. I would like to have, hold on. So Chenai is a 5-timer. Now, people, a few moments ago, I said 5-timer. You're going, what are you talking about? Believe it or not, this is the 5th time she's been on one of the platforms that I host in about 2.5 years. How have you done that?
I think you'd have to ask Dr. Wong because he did it. But also, we care about similar things. I will say that. We care about similar things. So we've had a lot to talk about, whether it was about refugee health, other symposiums, mental health, CPD. It's alignment.
Okay. So since you're the veteran, I'm going to let the rookie share some of her background first.
You can't even call her a rookie, by the way. The 3 jobs she said are her official ones.
No, but I mean the first time she's been on here. Okay, 5-timer. I know you want to take over the show now because you've been here 5 times. You want me to get up and leave? I can. You can just do it on your own now since you're a pro. Okay. Dr. Norris, share a little bit about yourself with our wonderful audience.
Oh, well. I was born in Haiti. So, I like to tell that to people because Haiti has such press in the news. And, as a francophone in Toronto, I want to represent, I do have family in Haiti. So, and as a result, I studied medicine in French after actually working as a physical therapist and studying physical therapy in English McGill. So, having that background, I came to Toronto to complete a subspecialty in geriatric medicine, which I topped up with a master's degree in health administration. So I'm one of those jack of all trades. You know, as an internist geriatrician, I focus a lot on dementia care, falls, but I'm also been involved with a hospital training program where I brought a lot of racialized, minoritized physicians who had trained outside of the country into the healthcare system by offering them a training position at Sunnybrook. And that kind of made my reputation as a go-to person if you're trying to re-enter the system in Canada. And with that reputation of, you know, building a program called the Hospitalist Training Program, I was called into this position of faculty lead for Black and Indigenous learner in the Department of Medicine. It got me really involved here in advocating to make the rules for admission into residency more inclusive, and also act as a mentor for a Black medical student and Indigenous medical student who wanted to go into specialty medicine, and core internal medicine is particularly competitive. It is the trunk that leads to specialties like cardiology and nephrology and oncology and critical care and geriatrics and rheumatology and all of those kind of elitist specialty, subspecialty. And when I started, there were 0 applicants from University of Toronto. And last year we had 5 applicants from University of Toronto. And, you know, if you think that each year there's about 20 Black medical students who compete for residency, and only 1 in 3 will stay at U of T. And out of those 20, they can apply in all specialties, subspecialty family medicine, and that we got 5. I think that that's real success. I'm really proud of that success, and to have been trusted to advocate for Indigenous learners is a big thing. You know, as a geriatrician, I'm really passionate about advocating for frail seniors, and I was a physiotherapist, so fall prevention is something that I was very active in. But I found recently that dementia is such a big topic, and dementia in the Black community has a need for an approach that's more holistic, because a lot of the care in dementia is focused on drugs. And, you know, the history of Black people and medical experimentation is not a nice story. And also the labeling of dementia, which means out of mind, that labeling has been changed for neurodegenerative disorder. But for many older folks who come from the Caribbean or Africa, it's like your family takes care of you. And of course you're gonna slow down when you get old. What you mean you got dementia? It's like, I'm just getting old. And what you mean? Mom can't do things for herself. Of course I'm gonna do things for her. That's what we do. You know, why do you need a drug? So I have found that focusing my effort at informing about other approach to dementia care besides drugs is really valuable. And, you know, I like to tell people that the brain is not just for thinking, the brain is for moving. And, you know, there's a lot of data that shows that, you know, with exercise, better sleep, you know, treating hypertension, treating hearing impairment, watching, you know, toxic drugs like alcohol or other prescription drugs, that you can actually improve brain health. So more recently, I've been more involved with marginalized seniors and doing memory clinic in French with the Centre francophone du Grand Toronto. And half of that population is Black Afro-Caribbean. And also doing visits in socialized housing at the Centre d'accueil Héritage. and also being a geriatrician at Bendel Acres in Scarborough, where there are many institutionalized frail seniors, and it's an opportunity to serve the community. And I had discovered that there are Haitian-speaking Creole seniors, so now they have dementia, and the only language they can access is Creole. So I had to pull that out of my tricks, and to see their face lighten up. People who were basically left for not being there just because they couldn't communicate, in English. So it's been quite a journey, and I'm very passionate about what I do.
I can honestly tell, and thank you for sharing some of your journey. And Bendel Acres is not far from where I live, so I may want to. Let's get over to Chenai. Okay. No one has ever in my over 5,000 epic conversations said, I'd like to offer you a bed. Okay. I think I'm going to go a little bit in a different direction with you.
I will.
So, Chenai. Yes, redirect. Okay. So what I'd like you to share with our family, Chenai, is can you give a brief history of the symposium and its impact over the past coming up to 16 years?
Yeah, I think Black physicians, Black physicians themselves, because I think the symposium also connects back into our story as an organization, right? They were Black physicians advocating and supporting community health for years upon years upon years. But in 2007, that's when they decided to become a body of Black physicians. And then 2015 is when we incorporated. But over those 16 years, the flagship event we had is this annual health symposium. Now we do so many more things, but the symposium was everyone who is a physician and is Black had to be there because it was opportunity to meet potential mentors, to be able to actually have a bit of social with the rest of your counterparts, right? Black physicians only make up 2.3% of the physician population. So rarely are they in rooms full of people who look like them, right? So the symposium was really important for that. And just to say, some of the founding physicians of our organization include, Dr. Miriam Rossi, Dr. Upton Allen, Dr. Dominic Shelton was involved with it. Dr. Cindy Maxwell was our founding president. Like, these are stalwarts and sort of, they've become institutions in health, right? And so you can imagine when they were running the events right at the beginning, it's not like there was an organization or a budget or anything like that, but it was a very big community sort of run event. But the level of excellence at which they were working on these over the years, I think has just made it really blow up. And so now we get about 150 odd attendees total when you combine the virtual and the in-person folk. And it is an accredited event, right? So when you are a physician, part of why this came out is most of the accredited events they were attending were not looking at chronic conditions impacting Black communities. And so they figure, let's have something for us, by us, looking at the conditions that are impacting communities. So, looking at this year, that's how we're getting into, whether we're talking about geriatrics, we're talking about prostate cancer, we're talking about chronic kidney disease, we're talking about cardiovascular disease, the same big sort of repeated chronic conditions that I still maintain are also related to social determinants of health. So that's one of the elements we also put into our symposiums. I don't think a lot of health symposiums focus on that, but we make sure it's kind of woven in because, you can't get away from social determinants of health as a Black patient or clinician.
Excellent. I'm just going to stay with you for another moment. What is the theme of this year's symposium and why was it chosen?
Well, every year we say numbers. There's no theme per se. Our president is still advocating for that. She does not enjoy that it's just like 15th, 16th, 17th. But I would say the overarching theme we have in every year is how to improve health equity and quality of care, right? To improve sort of like the care racialized people are getting. Because as much as we talk a lot about Black, I think a lot of it then applies to other racialized patients who also might not be getting appropriate care. So some of the work people like Dr. Norris are doing is groundbreaking because it's never included communities like ours.
And then my next conversation piece, and I'll come back to Dr. Norris because I know she's still on fire. The other conversation, please. Why is it important to have a dedicated space for Black physicians, medical learners, and allied health professionals to convene?
Well, I'd like to talk about mentorship. When you are surrounded with people who look like you, there's an element of trust. And that trust is not only important for well-being, that trust is important for mentorship. And so, I come from a family where there are a few doctors, cousins, aunts, and therefore I had that model that came from my family, even if around me I didn't see Black doctors. The Black doctors that I saw in my family are in the United States. So when we gather and see other people who look like us, who are doing great things, it brings an element of trust in terms of taking that advice towards how do I make myself better? How do I make myself thrive in an environment that is otherwise cutthroat? And the institution in which we learn medicine, our colonial institution, our universities, our hospital, are modeled after, the colonial powers that have served to oppress Black people. So as we are going through the training, we experience a certain amount of feeling othered, feeling that we don't fit, feeling that we're not good enough, experiencing aggression, racism, and that wounds us. So when we are surrounded with peers who get us, we can be real, authentic, and receive the feedback that we can trust towards being better version of ourselves as physician, to be guided towards treating the community. So until the pandemic, I had never really been in Scarborough, right? I'm Francophone. I arrived in Ontario. I was 36 years old. I focus on geriatrics in Leaside. And if it had not been for the pandemic and the Black Vaccinator Initiative, I wouldn't have been in Scarborough providing vaccination. And then the experience of being surrounded with other healthcare workers who look like me, to treat people who were like me, was very empowering. And it really set me in the direction of wanting to do more for the community. So to answer your question, working with other people who are in healthcare who look like us is healing, helps with mentorship, is empowering, is validating. It makes us feel safe. Reminds us that, well, for all the trauma we experience in training and in hospital and surrounded with others who didn't look like us and make us feel that we're not enough, in the end, we realize, oh, that was all, if you want, like a big lie, right? And then we're being reassured that we matter and and that others know what it is that we've gone through.
Wow, Chenai, are we happy that she was able to get herself back on for the conversation? Because family, about 2 minutes before we're going, well, actually 15 minutes before she came on, she was ready. You said, okay, you may sound better on this device. She came on great. So she compared and then we lost her. And while the intro was coming on, she appears. She came back from Haiti and just landed on our doorstep with a few minutes to spare.
I mean, she's a true Dr. Miracle. I will say, though, one of the other things she recently received was a recognition from the Crown with that, what is it called? Like,
it's called the King Charles III Coronation
Limited edition.
A little medal.
You know, I really, between the 5-timer and the recipient of all, well, and Chenai's family, go to Chenai's LinkedIn page. Every time I go there, she's received another award. So don't put it all on her. Both of these ladies have huge amount of recognition from various credible organizations. So blessings to both of you on that, by the way. Blessings to both of you on that. So Chenai, to you, I want to get you to say anything you want to add and why it's important to have a dedicated space for Black physicians, medical learners, and allied health professionals to convene.
I mean, added to the mentorship point Dr. Norris mentioned, the Black Medical Student Association, and I think it was the AFMC, a few years back did research on, essentially what are the barriers to Black medical learners becoming physicians, right? Because there were always these little sort of bottleneck periods, and we needed to make sure there were resources and support for that. So Dr. Norris is actually one of the co-chairs on the Network for the Advancement of Black Medical Learners, because we have to even help all the med schools in Ontario prevent some of those things.
You mean the Dr. Norris that never sleeps?
She does not sleep. Honestly, when she was describing half the stuff now, I was like, some of it was news to me even. And yeah, so she's got a different kind of rap sheet, okay? But she.
Well, at least we've got from me being offered beds to rap sheet. What?
Listen.
Okay.
To me, it's now an accusation, because it's one thing to give 8 hours of your day to care. This woman gives 24 hours of her day to care. So any recognition she gets is still not even touching the iceberg of how much work she's doing across community, and how much time she gives even to the learners, right? So what I was saying is, a lot of medical learners don't get mentorship because people are more inclined to want to mentor people who are culturally, linguistically similar to them. So some of our learners are being sort of, sidelined because, you have an accent, you're internationally trained, you're, things that are not in their control. And these people are beyond competent, but the way they're treated, they need a soft place to land. So I know some of the amazing physicians we have in our midst all have a story of someone who basically stepped in for them. Andrew, I think, told you that his neighbor is the reason he ended up becoming a physician, essentially, right? His neighbor brought him to these symposiums. Onye, I know, got like mentorship doing things at Taibu and all of that, like under Dr. Rossi. Like, without the care of faculty, the work is just so much harder, because no one is going to go out of their way to let you know what you need to actually graduate.
Wow, that's fantastic. So family, we'll just do a reset here. We're talking with Chenai and Dr. Norris, Dr. 24 hours never sleeps Norris, about the Black Physicians of Ontario 16th Annual Symposium. For more information, it's up on the screen, but it's in the comments section on all the platforms that you're watching this live or on the replay. There's information about the symposium, registration, agenda. It's being held Saturday, February 22nd, 2025, 8:30 a.m. to 5 p.m. My Hall Center for Engineering and Innovation, an entrepreneurship building, University of Toronto, downtown campus, 55 St. George Street, Toronto. And also, if you want, there's the website information for the Black Physicians of Ontario, Instagram, LinkedIn, Facebook, YouTube, X. It's all there. It's all in your comment section. So before we go any further, there are one or two comments. Miniam Khan says, good evening. She also asks, are you connected to the Race and Disability Canada or the Ashe Community Foundation for Black Canadians with Disabilities?
Yes, Ashe are good friends, I would say.
Okay, good stuff. And she also asks, Ashe Community Foundation is having a webinar coming up about why diagnosis matters. And also, she says, and also Black Mental Health Canada, BPAO needs to connect with them. She probably has already, right?
Yeah, I think, what's her name? There's a lady we're speaking to at Ase, but I will. Let me check
No
my
problem.
email.
No, it's all right. It's all right. You need to breathe once in a while too, right? So, all right. As we get back, next conversation piece. What are some of the most pressing health disparities affecting Black Ontarians today?
I think Dr. Norris can start.
Well, I'm going to speak from, my landscape, if you want, as someone who trained in medicine, I certainly have witnessed the tremendous morbidity and mortality of high blood pressure, right? Like, I have witnessed gruesome death associated with high blood pressure that led to intracerebral bleeding. And think of the brain as a cucumber inside a glass jar. If there is bleeding of the brain, there is no room for that brain to expand when it's bleeding. So what happens if blood pressure is so high as to cause the brain to bleed? The brain squeezes out of the skull like toothpaste, and therefore it's a gruesome dying. And I have seen that happen. So the challenge is that blood pressure is often not felt. People may feel tired, feel a headache, feel short of breath. They're overweight. They think it's because they're overweight. They don't sleep well, and they don't go and measure their blood pressure. So it's a deadly killer, particularly in the Black community. And while I am a geriatrician, I train in internal medicine, and therefore I have witnessed the morbidity of high blood pressure in the Black community. In the same vicinity associated with that is the disproportionate prevalence of diabetes. And diabetes is not just a sugar issue. It's a metabolic issue. Meaning the way sugar fat is processed is affected by how insulin is processed in the body. And when a person is under a lot of stress, and we've seen that racism is associated with what we call weathering, and this constant stress has an impact on our stress hormone. Those stress hormones include cortisol, adrenaline. It puts the body of Black people at higher risk of diabetes. We see diabetes type 2 associated with obesity. And, obesity is not just because a person may eat more. It's also how a person metabolizes carbohydrate and fat. And, the body is 60% water. So that excess weight is not just fat. It's also, how water is absorbed in the body. So I would say really, from my vantage point, that high blood pressure and diabetes are huge. In America, gun and death by gun is a big issue, and there is more of that happening in our community, if I speak of Toronto. But as an internist and someone who's involved with aging, high blood pressure and diabetes are not only more prevalent, but they accelerate aging. So that our older people who are Black may be aging prematurely because of the compounding effect of those cardiovascular risks. And I'm not even expanding on all the other cardiovascular risks that trickle and are byproduct of those first two big ones.
Chenai, anything you want to add? You're on mute.
You're on mute.
Sorry. One of the other speakers at the symposium is our former board member, Dr. Hussam Abdelkadir, who's a cardiologist. He's going to be talking about some of that because he did interesting research on lipoprotein A that is very prevalent in sort of like Black people, but you can test for it, and people don't even know that you are covered by OPE to be able to test for this. So he worked with some community health centers on helping people be more proactive about some of those risks as well. So there's a lot going on.
I can imagine. Let me move on to another conversation topic. How do systemic barriers continue to impact Black patients and healthcare professionals?
I would say that the advocacy bit first, right? My instant response is just the advocacy side of it. If you are in the hospital room and the doctor does not believe what you are saying, those are going to give you significant challenges for appropriate diagnosis and also appropriate treatment as a result. So I think just on the base of that alone, that's already a really huge challenge. The other is in certain spaces, especially hospitals. You've heard of certain hospitals that people in the community will refuse to go to because of negative treatment in the past. So right now, 22% of Canadians do not have access to primary care. And the guesstimate is that for Black community, it's sitting at 47%, which is crazy because that means for every 2 people, one person doesn't have a doctor. And so those are huge barriers, because if you have a family history of certain conditions, but no one's tracking it with you and working on it with you, you're in trouble. So there are people getting, prostate cancer, breast cancer, all these different things because they just weren't even getting screened at all.
Yeah, and I would add, there's just so many barriers. But if you think that only 2.3% of the doctors are Black, and that in Toronto there is more than 10% of the population that is Black, and that Black people being treated by a Black doctor will have better outcome. We have this data from the United States. And more of those preventative conditions will be addressed if you're a Black person being seen by a Black doctor. There's better chance that your high blood pressure will be treated, that your diabetes will be treated at target, that you'll get your vaccination, and therefore you'll have better health outcomes. So a big issue of access, and access being limited by the number of doctors, further accentuated by the fact that Black doctors are that much fewer. And there is also the knowledge and the trust in medicine as an institution, given the legacy of abuse of medicine as an institution on Black bodies, and slaves in the 1800s who were used as experiment by doctors. And there are a lot of literature that documents that. A very good book that details that is Medical Apartheid by Harriet Washington. So this legacy where experiments were first done on Black people before the benefit of these results were then applied to people who are not Black. Think about the COVID vaccine. A lot of the testing of the COVID vaccine was in Brazil and in South Africa. And once it was found to be safe, then many of the vaccines were shipped to Europe. There was a higher uptake in that population. So there are many factors associated with the barriers. And, a lot of the doctors live in more affluent neighborhoods, and so there's a mismatch between where our Black brothers and sisters live and where most doctors live.
Yep.
100%.
The last I'll add is that you also have what they call racist equations that had sort of worsened conditions for Black patients, where there's always just an assumption, right, that because Black people are stronger, have higher pain thresholds, all these different things, they wouldn't get certain screenings. So one of the other talks at the symposium this year is updates from Dr. Bourne Auguste, who is a nephrologist, and talking about chronic kidney disease and how they've scrapped the racist EGFR equation that was basically leading to a lot of Black people getting to dialysis and things like that because they just weren't receiving care under the assumption they wouldn't get the disease.
Right, or not having access to kidney transplant because the equation falsely measure the kidney function as being less than what it was. Similarly, even in pulmonary function, the tool called the spirometer was invented by a racist doctor, Dr. Cartwright, who was a slave owner and who put race correction in the measurement of lung function. And this practice of putting race correction in the spirometry apparatus falsely limited the measurement such that a Black person would be seen as less sick and therefore less likely to be treated for chronic lung disease or to be a candidate for lung surgery. During COVID, we realized that the oximeter, the tool that we use to measure how much oxygen is in the blood by using infrared light, that tool was not calibrated on people with deeper pigmentation. And that data is proprietary to whoever built the machine. So during COVID, the directive to decide to start steroid or antiviral agent was based on saturometry, so based on the number that the oximeter was giving. So what they found out that if you put your finger in the machine and the screen says 96% in a person who has deep pigment, it might be falsely elevated. How do we know that? If you draw the blood and then measure how much oxygen is in the blood, they saw there was a 10% discrepancy, so that the 98% would be more like 89% real value. And therefore, patients who had deeply pigmented skin were falsely thought to be less sick and therefore will not be given treatment that could actually save their life.
All right, let's segue a little bit into what are some of the key topics being covered at this year's CPD sessions?
Okay, I think I definitely talked quite a bit about them, but the keynote is from Dr. Lisa Robinson. She is the first, I think, Black Dean of Trinity School of Medicine, but I don't know if it's first Black Dean in general in Canada or something like that. She was one of the awardees of the first Black Award last year. So I do think yes, there we go. First Black Dean of a middle school in Canada. So she's going to be talking a bit about her experience and the kind of leadership that she's doing in health equity. We're also going to have a chat from Anthony Henry. A lot of people have heard from the Walnut Foundation talking a bit about the work that they do around prostate cancer. They've done incredible work in supporting prostate cancer patients and survivors. And then also one of our board members, Dr. Rebina Simpson, is speaking, and she's going to be talking about, she's a pediatric hematologist, but she's going to be speaking about updates and best practices in sickle cell care, because there've been a lot of new updates and things that have happened as far as sickle cell care. I know Ontario Health released the sickle cell quality standards, so there's going to be some talk about that as well. And of course, the incredible Dr. Mireille Norris is going to have her breakout session, which, by the way, I think is almost oversubscribed, because the room she's in is supposed to only have 60 people. And I think everyone has kind of put it as like a first option. So
why would hers be oversubscribed?
I mean, but anyway. And then we have Dr. Hussam Abdelkadir that I had mentioned. He works at Women's College Hospital. Yes, he is going to be talking a bit about that lipoprotein A, a novel risk factor, and some of the work that they've been doing. He also, I think, works with Heart and Stroke Foundation on some things. He's another one of those busybodies. He's like an MD, PhD, super brilliant somebody, but at the same time, very humble. You'd never know. And as I mentioned, Dr. Born-August, the nephrologist at Sunnybrook, where Dr. Norris also works, is going to be talking about that new GFR equation, the Ontario Renal Network, where Dr. August works, has been doing amazing work in trying to remedy all of that. I really loved the role that our Black nephrologists have played in the ORN as well. Dr. Ayo Adotayo is actually our new director of continuing professional development. He was mentored by Dr. Abdel Kadir, and he's also a nephrologist, and you'll get to meet him as well because that's his day. The symposium is the CPD director's grand day.
Okay, so I also want to ask about the role of implicit bias in healthcare and how the symposium is going to address this issue.
I would say all our symposiums, when they're giving presentations, they will, like the speakers tend to talk about the places where sort of like there is common practice that's not correct, if that makes sense. So a lot of the talks always have this element of, this is what you're told to do, but you need to also know about 1, 2, 3, 4. So some of those things are looking at the implicit bias side of it. But I would say related to that, we are still struggling to get a lot of non-Black physicians to attend the events. I think they assume because of our name, the events are only for us. But yeah, we actually, we exist also for better quality care to Black community. So we understand it's not only, Black doctors who need to improve on that. So I think that's one of the push things that we'd always want. If there's anyone listening who knows good allies, share with them. We need white clinicians attending these events, Indian, Chinese. If you are not Black, you need to attend these events and learn it, because I think that the usual guides they receive aren't going to cover half of this stuff.
That's true.
Dr. Norris, anything you want to add? You've been quiet for a few months. I wanted to give you a rest. Anything else? Like, because I have a number of conversation pieces. So if you want to jump in, or I can continue on.
I think that, when you think of implicit bias, as a Black person, I have been educated and formed in a white institution. And I had to unlearn some of what I was taught, because medicine has ties to eugenics. And so in the 1800s, when the advance of the superior race, that was advanced by doctors. So here it is, I'm a Black person, but I'm being taught by white doctors in white hospital, in white university, books that are written by white men. So there is some of this learning that we have to unlearn about where race was tied to biology when it is not. As humanity stemmed from Africa, and there is more diversity within people of African ancestry, and that there isn't a difference in gene across races. And that has been revealed to the Human Genome Project. So we're now needing to overcome some of the unconscious bias that has been fed into us as Black physicians.
Excellent. Want to continue on. Are there any new initiatives or collaborations being launched at this year's event?
Interestingly, yes. The Black Health Advisory Task Force is going to be having a primary care meeting the morning before the symposium. And then Enable, we're going to have a Dean's Welcome Breakfast as well, where we're going to be finding out about what are the updates to the commitments in care that medical schools essentially are going to be giving. And also just to say obviously there are organizations like our sponsors who make some of these things possible. This year, I think it's been really great. We've had a lot more sort of sponsorship interest because the content is just really, really strong, So we've got like Novartis, Novo Nordisk, Amgen.
Yeah, when people get sponsorship, you make my heart smile. So I'm leaving any potential heart attack now. Good, all right. My heart is smiling. That's beautiful.
Yeah, and MD financial management, and I think there's just been a lot of interest for people to connect more with our physicians. And I just know that if you're a medical student and you go to that, it's inspiration upon inspiration.
Okay. And what strategies or solutions are being discussed at the symposium to build a more equitable healthcare system?
Well, part of it, as we said, is that like improving care. And then when you're looking at the learner side, with what we're going to be having in enabled discussions, it's about the institutional and infrastructural barrier, right? Because there are a lot of medical learners who do not get to even complete their residency over sometimes ridiculous reasons, right? So if there could be a bit more of an acknowledgement of anti-Black racism, I think in medical education, as an example, that'll be a huge changer. I would also like to see, the process of bridging for international trained physicians be a bit more streamlined. Right now, I think internationally trained physicians are coming sometimes with immense expertise, but it's a shot in the dark for them to be able to practice again. Some of them are having to do 4 to 5 years or something of sort of relearning and things like that before they can practice. And the few that can afford that do it. A lot of people just end up pivoting out of it altogether. So I would love if we could be a bit more supportive of.
Yeah, that's concerning too, because I know people hear enough about health crisis in the United States. We are having a health crisis here too. So when we get qualified individuals turned away, we have to think how many people's lives have been impacted because of that.
Seriously, we have a shortage right now of about 14,000 physicians in Ontario.
Wow. And
I think the OMA was reporting that over the next, at that time they had said 4 years. Now I think it's about 3 years. They were up to 60% of their physicians are reporting either pivoting out of, family medicine and things like that, or early retirement, right? That figure used to be 17% when they used to report it. So there's a lot of burnout and a lot of people are just overwhelmed.
Dr. Norris, do you want to add anything to what Chenai just said, or?
Well, I mean, I think from my vantage point as a educator and an advocate for mentorship, I like to empower students to go beyond medicine. So not only make sure that they do well as physician, but consider developing skills in research or skills in quality improvement or skills by getting a master's degree in systems leadership and innovation. And I have mentored many learners in those directions, because if we're thinking about changing the system, it's important to do work at the bedside, but you need to have the skills to be at the negotiating table. You need to be in position where you speak directly to the chair of medicine or to the dean of the faculty of medicine, or so that the Ministry of Health wants to hear from you. And you will have the skill set to be in those tables, to influence healthcare by going after those extra skills. So Chenai had mentioned Choices, the research project that we did called Community Hypertension Outcome Improvement through Computerized Education Seminar. So it's choices for using Zoom to teach how to improving nutrition literacy applied to the Afro-Caribbean diet. You can actually improve your high blood pressure and get better numbers and use less drugs. We've been able to get funding for this, thanks to BPAO, also Black Research Network, and other grants such as what I've received as support from Sunnybrook. And data from this kind of community-based resource has been shared with the Ministry of Health, who is interested in approach to improving high blood pressure in Black people, but also using virtual tools that are low cost, high yield to help bridge the gaps in healthcare. And so this is a way where we can impact the healthcare system beyond the one-on-one at the bedside.
Nice. I know over the last few moments you've talked about some of the challenges for internationals coming here, and like to say now, new Canadians who have a lot of health experience. Are there any big challenges being faced by Black medical students and residents in Ontario right now?
Oh yes, yeah, definitely. And I think for a lot of, we sometimes support residents who've been either booted off their program or are at risk of being booted off their residency programs, and a lot of times they are actually internationally trained physicians. I think that mistrust is even higher because they're not just dealing with anti-Black racism; they're dealing with the xeno kind of racism linked with it as well. And so we've had to tackle some of those really difficult conversations with some of either the residencies or the medical schools that those learners would be attached to. I would definitely say there's a challenge with that. But the irony, I will say, is we found that in rural Canada, where internationally trained physicians have gone, some of them have managed to accelerate their bridging faster because I think of the level of need. And even when they've encountered anti-Black racism, I think they end up becoming sort of critical to the community, because when a physician retires out there, you might be getting an additional 1,000 patients overnight, right? Or more, actually. I think some of them have reported even having
Can you say that again?
When a physician retires, that's easily an additional 1,000 patients to someone's caseload. So the waiting lists are insane. So I think people get to a point where they might start up saying, I don't want a Black doctor and all these different things, but it can only last so long before you need care.
So you see why I go to my doctor every month?
I mean, other barriers, right? Medical school is very expensive.
Yeah.
So just to get, before you even start medical school, you might have had a bachelor, a master's degree, a PhD. You've been in university now for 6 years, if not more. And then you embark on medical school, which is very costly in terms of studies, tuition, the cost of living in the city. And then these are studies that are so demanding that they really prevent working on the side. And this heavy debt burden can be a barrier, as it is a heavier debt load on Black learners than other learners. We have data mainly from the United States that shows that. But as the Black Health Team lead, learners have shared with me the extent of their debt, and it creates a barrier to further training, specialty, subspecialty, that are a family medicine with added capacity that allows the physician to be now in those leadership position where they can impact the system. On top of the experience of racism during training, be it at the undergraduate level or postgraduate level, that can wear a learner down and cause them to drop out.
So some comments here from Minnie on campus says, I wish I could have a Black doctor who follows up on my MS. She also says, it's not like our healthcare system gives you a preference of choice unless you seek them out. Like I found the dermatologist, then brought the referral to my GP, found out they were classmates. And she also said, yes, there's a new story of the Walkerton Clinic having thousands waiting for 500 spots. Wow.
Pretty much. But also just to say, look at BHPN. They are a directory.
Yes, Black Health Professionals Network, yes.
So I do think it's like, as they're adding to the directory is really important. Every time a physician says, I'm taking on patients, I'm always like frantically saying, this person just announced it, and overnight they're like, full.
Stuff. How does the BPAO mentor and support the next generation of Black healthcare professionals?
There's so many programs, but I will say, so we partner with Black Physicians of Canada on some of their mentorship pieces, but we also have what we call mentor pods. So for medical students who want to get into certain specialties, they're allocated to someone who is a specialist in that area. So if you're interested in nephrology, you're going to have, a nephrologist mentor. Of course, a lot of these people are very busy. We just give them an honorarium to give a bit of their time to actually take all the questions the learners are asking. So that's a big part of it. We have the Community Health Center Education Program. We put medical students in second and or third year in the community health center so they can get exposure to working with racialized community and learn a bit more about that. Because in the hospital space, they don't get to work with as many diverse patients. And that's like a 9-week summer program. We give them stipend, we cover their insurance, everything. And they've had amazing capstone presentations they do at the end. One of the capstone presentations this past year was basically a business case for the course itself, for CHCE. And that was founded by Dr. Dominic Shelton, one of our founding physicians. The other thing we do is we do a welcome social for all people accepted into med school. So in the summer, they get to meet, our physicians and get all the sort of warnings they need when they start out, like this is who you need to know, this is your community of support, all those different pieces, because again, that event might be the only time they might all be, Black learners together. They're probably going to go in programs where they might be spending a lot of time as a lonely only or two or so. And then the other thing we do for medical learners is we do support the BMSAC. They do a lot of events. They have AGMs and all these different things that help to sort of mobilize the medical students across Canada. And they also do, I guess the AGM sort of rotates in different provinces. And then we also support pre-medical learners. Some of them have like associations linked to the universities, and we try to offer sponsorship for that. But I will still reiterate, we are a Black organization. We are not immune from the underfunding that happens for Black nonprofits who get something like 7 cents to the dollar of mainstream organizations. So a lot of this, there's a lot of bootstrapping. So I really do hope that this year we can see a bit more of that support of the funding of the initiatives, because everything is always kind of piecemeal and not sustainable.
Right. How does the BPO engage with Black communities outside the symposium?
Ontario Health is our partner on the Black Health Plan. So we have projects through Ontario Health that are funded by Ontario Health that allow us to work either with community health centers on some best practice things, but it could also be something as small as being part of advisories on work Ontario Health is doing. So Ontario Renal Network, that work that I was talking about with Dr. Auguste, we sit on the renal network. We are part of Black Health Plan sort of working groups and strategy sessions. And these symposiums that we do are actually co-supported by Ontario Health as well. So we get that that community-facing arm. Another example of an event we're involved with on the 1st of March, there's going to be a Durham Black Health Wellness Day. I have to actually just shout that out.
Yes, I've seen that. Yes,
there you go. Yeah, so we'll be there. If you want to meet us, we're going to be there. We have panels, and I think some of our learners also.
Would Dr. Norris have a bed for me?
Well, you live close to Bendel Acres, so you can come and tour.
Oh,
and choose the one you want.
You see that, Chenai? She's not pushing back on it, eh? She's just like, come. Let me get her talk about something else. So, Dr. Norris, how can institutions and policymakers increase diversity and inclusion in the medical field?
Well, I'm very blessed that I work in an organization that has done that. I work at Sunnybrook, and Sunnybrook has an office of social accountability and outreach. And you can see there's a lot of education in my organization, or anti-Black racism. We celebrate Black History Month in a very active way, through the Office of Accountability and Outreach and Social Justice. There's also the President Anti-Racist Task Force led by our CEO. I was part of that task force, and that task force has a reach of education. We have teaching on anti-Black racism for staff at Sunnybrook. I'm involved in a study looking at anti-Black racism in internal medicine and psychiatry, and that is funded out of AFP dollars that come from the Ministry of Health, but also the hospital. So you have to be very intentional. You know, when you walk at Sunnybrook, you will see, you know, Black Lives Matters. You will see a lot of representation of Black patients on the communication. You know, there are many Black healthcare workers. You know, there is policy that states, you know, that there's zero tolerance for lack of respect. There are mechanisms to address racism at the corporate level.
Chenai, anything you want to add?
In terms of Sunnybrook or where?
No. Just any. How can institutions and policymakers increase diversity and inclusion in the medical field? Because I saw your facial expression when I gave that question. I said, "You're not getting out of this one." Dr. Norris ain't going in by herself.
Listen, I will just say that their approach to DEI or anti-Black racism and things like that needs to just be better than a talk piece. You know, you will have a lot of organizations kind of say, oh, you know, we have nothing to talk to you about because it's not February, you know. So I think there has to be an interest in some of what we do. And again, I will reiterate, even though we're Black physicians, so much of the work we do benefits all of Canada. When we were advocating for that breast cancer screening age to be decreased, it wasn't just for Black women, it was for all women, you know. So I think there isn't enough interest into sort of like harmonizing the work. And again, I tell you, things like the funding side of it show it. You know, there are very few organizations that are interested in working with us in some of the things we're doing. And yet, to Dr. Norris's point, they're very simple interventions that don't cost that much, that will make huge differences on the health outcomes of racialized community. You just need someone willing to kind of say, hey, I'm looking for people doing this and supporting that work. Because unfortunately, the hospitals, I don't think have the capacity to do it instantly. Right. The political will, but also just the level of burnout in some of those spaces. If you're drinking from a hydrant, you don't really care about the preventative side of things because you're used to reacting. We do the kind of work where we're saying, hey, prevention is better than cure, and we objectively agree on this. So let's work together. And I do think it can save a lot of places money, especially if we're looking at our health funding, if we have that approach. Because to your earlier point, if you do not make time for your wellness, you'll be forced to make time for your illness.
Right. What are some of the organization's ongoing initiatives to improve health literacy in Black communities?
So other than those sort of health fair events that we're doing and resources that we push out electronically, we are working on a patient self-advocacy manual because we had so many repeated cases of people saying, I don't know what my rights are when I'm in the hospital room. And if I have a family history of X, what can I ask my doctor for? What should my doctor be doing? A, B, C, D. It just became a really repetitive conversation. And I said, we need to create a resource people can use in the absence of a patient navigator, because patient navigators and community ambassadors for health make a huge difference on that health literacy side. So if you don't have that, a person should be able to then use this manual. So we have a scientific advisory committee made up of some of our residents, physicians. Juliana's part of it, Dr. Norris. So we have quite a few of our learners being involved in it as well, so that they can be ready to publish around some of these things as well. So it's a project that has started. They've already started some first drafts. So I'm excited for when we finally launch that and can make it available to everyone.
Okay. Anything you're wanting to add, Dr. Norris?
No, right now.
Okay.
Yeah.
Just checking in. So then let me ask then, how can individuals and organizations support BPAO's mission beyond attending the symposium?
Well, they should attend all the other events. we are more than happy to add you to our newsletter and share all our events. We have our second annual gala, 7th of June, at Liberty Grand. I think the tickets will be going on sale very soon. We have a fundraiser golf tournament that we do.
A lot of fun.
Yes, a lot of fun. And we usually support the Walnut Foundation Walkathon. Our members tend to go every year to support fundraising for Walnut Foundation as well. And I will add, we're about to have our charitable status. I think people should consider.
There's a game changer.
Yeah, so people, I think from about March or so, people can, people could always give to us and still get like their certificates. We'd use our trustees for that. But now I think it's really exciting that we're able to just issue those certificates ourselves. And I think people should tell their community members about, BPAO and get plugged in. I've seen lots of other sort of hospitals and foundations get help in the community. And I think our community needs that because we have so few members, but I'm telling you, there is a mountain worth of work that they're doing right now. I didn't even scratch the surface of how many programs.
Good stuff. Anything you want to add, Dr. Norris?
No, I think that, I have been involved with BPAO ever since its inception. It's very exciting. Yeah.
Okay.
I'm older than I look, I can't be a geriatrician and look my age.
Dr. Norris, behave yourself. Behave yourself. Because my mother told me there's two things you never discuss with a lady: age and weight. So you're not pulling me into that conversation. I'm sorry.
So definitely the organization is growing. I think that's we can be very proud of what is being accomplished. And, the way to show your love is open your wallet.
Wow. Straight shooter, eh, Chenai?
Well, I agree. I honestly agree because it's like, see it as an investment. Honestly, it's like we're not working just for Black people. We are working for everybody and probably putting in triple the work that any of the mainstream organizations would be putting into that work as well.
And I like the fact that you've said that the work you do doesn't just help Black people.
Well, just think about the pandemic. Think about how, COVID affected Black people, racialized people disproportionately, more morbidity, more mortality. More of the Black people were living in crowded space, could not social distance, were on the first row. And meanwhile, pharmacies that were delivering the vaccine were more prevalent in non-Black neighborhood. And, if you have Black people who are sick in a communicable disease like COVID, well, everyone is affected by that. Right?
Got it. I'm going to have two more conversation pieces because I know Dr. Norris has to get to bed one day. All right. First of all, what message do you have for healthcare professionals who may be hesitant to engage in conversations about race and health equity?
I would say, I don't know if Dr. Norris, are you already started?
No, go ahead.
I would just say, like, the oath that you take, the Hippocratic oath, I think forces you to commit to giving good care. If the inability to have the conversation is going to affect the quality of care you can give, I think that's a problem. So, it's not just about first do no harm. It's also if you can fix certain things, then do it. So if you are accidentally creating harm by not learning some of these things, then you need to learn them.
Yeah. And I'd like to say that, a lot of harm has been created by those who stayed silent in the face of injustice. I'd like to believe that when we recruit people in healthcare, we're seeking not just for bright people who are book smart, but people who have fire in the belly to advocate for those who are vulnerable. And that it takes courage, and humility. And if you don't practice being an advocate and speaking up, you won't develop the skill. So sometimes when I had some Black students, I said, you take on the role of Superman. Maybe, learn to take on that role.
Final conversation piece. If there's one key takeaway you want attendees to leave the symposium with, what would it be?
Those were great sessions. I think like we are used to getting that feedback, so I'm not even concerned. That is always the feedback. So I want that to stay the talking point, that they say, these were great sessions. I learned so much. And if they're younger, they're inspired to, still work in this very difficult sector.
Yeah. I want them to feel joy, feel renewed, feel empowered, and feel re-energized when they leave the session with a new set of skills in their toolbox.
Why don't we put it this way? We want them to feel like they have a new set of lungs. Had to get something medical in there, Oh, well, before we just cut it out and Mignon Camp says online courses would be beneficial here. And she also says, well-behaved women seldom make history.
I always say that. I love that, Eleanor.
There you go. Ladies, I want to say thank you for taking the time to hang out with us today. I enjoyed it immensely. I didn't know I had bed offers. Never, like I said, I'm never going to live that down. Never going to live that down.
Oh,
But
Dr. Wong is reminding me to repeat that the session is hybrid because we also always want to increase the access to folks far away from the GTA.
So here we go. Information again about the symposium. There's a link. Registration link, agenda link, and again, it's in the comments section wherever you're watching this live or replay. So you have no excuses. I don't want people saying, "Oh, Dr. Vibe, I couldn't get a pen." Look at your comments, please, and thank you. All right, and then Saturday, February 22nd, 8:30 a.m. to 5 p.m. My Hall Center for Engineering, Innovation, and Entrepreneurship Building, University of Toronto, downtown campus, 55 St. George Street, Toronto. Ladies, I want to say, as always, don't just manage your time, manage your energy. Remember to give yourself grace. And also, if you're not making money, make history. Good if you can do both. And then finally, and I know this is always in your hearts and all your members' hearts, make it better.
Thank you.
On that, I'd like to say God bless, peace to well, keep the faith, and walk good. And Chenai, we've met, but I don't know if I'm ready for Dr. Norris yet. I don't know. I gotta prep before I go to that surgery. I gotta prep. Ladies, a pleasure and honor. Thank you so much. And big thanks to Dr. Wong. You people don't know who she is, but one day you will. Take care, ladies. Be well and keep the faith. Thank you. Have a great night. All right, family. That is it. That was an epic conversation. I don't want any bed jokes anymore. Okay, no more bed jokes, please, going forward. Please, please, please. Let's behave ourselves. All right. So let's do a little homework before we get out of here. As always, subscribe to the Dr. Vibe Show on YouTube and hit the notification button. Want to get those subscribers up, and also share it out. Tell people about it. And also follow me on Facebook, LinkedIn, and Instagram to advertise your business, product, or service on our show. Please email me, dr.vibe@thedr.com. And you can catch let me do this first, how you can find me. The Dr. Vibe Show website, YouTube, Facebook, and LinkedIn, The Dr. Vibe Show. Instagram The Dr. Vibe Show. X, dr.vibe@the and email address, dr.vibe@thedr.com. And you can also catch me on Blue Sky at drvibe.bsky.social. There we go. There you go. And then one other thing, you can catch replays of these epic conversations on the Dr. Vibe Show, YouTube, Facebook, and LinkedIn, and the Dr. Vibe Show website, the drvibe.com. As always, how we ended off, live your life as a dream. If you can dream it, you can make it. Sometimes you have to get smaller to get stronger. Block assumptions, then aim bigger, aim better, aim higher, aim wider. Love, faith, and respect. Again, don't just manage your time, manage your energy. Remember to give yourself grace. If you're not making money, make history. But if you can do both, even better. and make it better. God bless. Peace be well. Keep the faith. Walk good. And thanks for watching live on the replay. It's appreciated and not taken for granted. Wow.
Yep.
I feel like I'm in class with Dr. Alicia. That's a class I wouldn't skip. There's some other ones I'd like to skip, but I'm glad I'm not skipping this class tonight. So I am hoping you're catching this live, but if not, certainly catch it on the replay because this is good stuff that Joe is laying down here. I want to get ready. When I saw this today, I said one word. Aya!
Did you really?
No, I felt like it's an incredible document that I'm going to suggest that you take and use as a lecture piece wherever you want to go.